Welcome. I'm John Tucker. I'm a general dentist. I practice in Erie, Pennsylvania. I do general dentistry each and every day of my professional career. I got interested in dental sleep medicine about 6 years ago, and I'd like to welcome you to this introduction program and kind of give you a little bit of insight on what dental sleep medicine can mean to you. The purpose of these 2-hour programs are to give you some basic understanding of what dental sleep medicine is and what it can mean to your practice. I see a lot of dentists that would like to know more about dental sleep medicine but are just afraid to take the first steps. This 2-hour presentation is a great way to give you more education about what dental sleep medicine is and how you can involve it in your practice on a daily basis. It's reported in the literature that approximately 50 to 70 million people suffer from some type of sleep disordered breathing. We're at the forefront in our profession to help screen for these patients and help to identify them. If we look at the literature, work done by Terry Young et al., it's estimated that 93% of women and 82% of men are undiagnosed or not diagnosed with moderate to severe sleep apnea syndrome. The dental profession is at the forefront to be able to assist in getting these patients to be diagnosed properly and then to be able to provide therapy for them that will help in the assistance of their obstructive sleep apnea syndrome. In an article that was published in CHEST, which is the Pulmonary Physicians Journal, a study was done with approximately 1,500 respondents. They responded to what was called a Berlin questionnaire. 26% of those respondents were predicted to have high obstructive sleep apnea risk components. If you look at a typical practice that would have approximately 1,700 patients, that would mean that there'd be 440 patients that are at risk for having obstructive sleep apnea. That's a huge component of your practice that's currently part of your practice that's not being treated. They haven't been diagnosed yet. So the numbers are huge that we can assist in treating these patients and assisting them with their comorbidities. So based on the information that I've just shared with you that is from the literature, I think it's very apparent that you can see this problem is real and it affects a large portion of our society today. We can talk about the associated comorbidities with obstructive sleep apnea, cardiovascular disease, blood pressure, diabetes, depression. All of the associated comorbidities with obstructive sleep apnea affect millions of Americans. And once again, we can be part of this whole treatment approach for our patients. Approximately 50% of the patients that are diagnosed with obstructive sleep apnea are placed on CPAP and fail that treatment. So the population that's out there that has failed CPAP therapy has no alternative therapy for them or that's indicated for them other than possibly considering a trach. And that's where we shine by offering the patients that fail CPAP therapy the chance to have treatment with oral appliance therapy. I got involved with dental sleep medicine initially because it had a personal effect on my life. I have obstructive sleep apnea. There is a long lineage. If you look at my father's side of the family with obstructive sleep apnea, our son Chad has been affected with obstructive sleep apnea. So I take this very personally, and I've seen the effects of untreated obstructive sleep apnea and what it can do to a person and what it can do to their family. And the results that we're able to provide as a dental profession are just absolutely astronomical in how we can assist in helping the patient's quality of life. So what about you? Why should you get involved? Why should you incorporate this into your practice? I think the best reason that I can give you is because I've seen the effects, the personal effects it's had on our patients, on patients' lives. I've done a lot in my 30 years of dentistry and done all the big crown and bridge cases, all the big implant cases. I never, ever once have had a patient send me a card and bring me presents that have said, "Thank you for giving me my life back." You see, you can now help in assisting a patient with therapy of a disease with all these associated comorbidities that the patients are so happy to be in treatment and involved in therapy that giving patients a chance to say, "I just had the best exam with my physician that I've ever had in 16 years. That's mind-boggling to me. That's better than a 10-unit veneer case. That's better than a full implant-supported fixed bridge. Patients' lives are transformed. I've seen it with my own eyes. I've experienced it with my own eyes. And the rewards that you would get personally from becoming involved with this are just astronomical. It's hard to explain. As I said before, I got involved heavily with dental sleep medicine about 6 years ago. I kind of played with it 10 years ago and really didn't understand it and really wasn't prepared to make that leap of faith as to how it could transform lives. As I said to you before in this video, it does transform lives. What does it mean to your practice? If we're all honest with each other, and I find that most of us don't want to be honest with each other unless we're out of town, and then I think the truth will come out. The dental practice, as we now see it and live it, is different than it was 30 years ago. It's different than it was 10 years ago. As I said, I live in Erie, Pennsylvania. Erie is in the Rust Belt, and the latest headline in one of our local newspapers was Erie Exodus is still on. So I don't live in a very affluent community where we're growing by leaps and bounds, and I see dental sleep medicine as another component to add to your practice. It definitely has a great ROI, and not only are we seeing a good ROI, we're also seeing it transforms the lives of so many people. It's a good thing for you to add to your practice. It's a great adjunct. You can get as involved as you want. I think the biggest stumbling block for most of us as dentists is this. This is a medical disease. I like to say it's a medical disease with a dental solution. As it's in medicine, we need to work in tandem with our physicians. And I have found that physicians welcome us with open arms, something I was really shocked about. But since it's medicine, we have to learn how to deal with medical insurance, and that's the big stumbling block. Because I don't care what your protocol is, we all need to get paid. And you have to learn how to bill medical insurance. Love to have you come be at one of our 2-day seminars where we teach all the idiosyncrasies of dental sleep medicine. We talk about what sleep is, and we talk about how it's treated with CPAP, which stands for continuous positive air pressure. And we talk about the benefits and risks of oral appliance therapy. We talk about multiple appliances. We talk about home sleep testing units. And we also talk about how you can get paid for it and how you bill medical. Once again, a medical disease with a dental solution. It's one of the greatest experiences I think that you'll ever add to your practice. Like I said, it's life-changing. It can be life-changing for you, but more importantly, it's life-changing for the patient. I really would love to see you at one of our 2-day programs in the very near future. Come learn with us. Come have fun with us. Come learn how to change your practice. Come learn how you can have a positive impact on someone's life. Thank you for taking the time to attend this program. I look forward to seeing you soon.